Thanks a lot for coming in.
Good morning, happy to be here.
Something about this community appeals to you?
This is a wonderful place to live.
For Kelowna Now, this is Kent Mulgat. And we're joined by Susan Brown, the new CEO of Interior Health. Thanks so much for coming in.
You're very welcome.
It's so great to have a chance to get to know you right off the bat. There aren't even any complaints about you yet. You're already here.
It's only day 4.
Day 4.
Yeah.
So do you start this with a big list of things you're going to change?
No, I start with what we're going to keep doing.
Right.
And I think that's really important because we have some great work underway right now. So we need to keep the momentum going on those. And the one thing that I am looking to do more is continue to engage our physicians and our workforce, because we know really well engaged workforce helps with productivity and best patient care.
Right. With the departure of the last CEO, there was some stuff out there that suggested that there was some unhappiness within the ranks. Is there something that you're sort of striving to sort of get people to feel empowered or more listened to and maybe sort of make it a little more upbeat?
Yeah, I think all the health authorities in British Columbia have seen surveys come back that haven't been demonstrating that they feel engaged and listened to, and that's part of what we need to do as leadership in the organization, is ensure that our frontline people are listened to, and part of that may be pushing decision making down so that there's some trust within the organization, or enhanced trust. So we'll be looking at that going forward for sure.
Does it help that you have risen through the ranks starting out as a nurse?
It's helped me. It helps me ask the right questions, and it does help me with a bit of knowledge about how healthcare works. And I've worked in 2 different countries. I started my career in Scotland and then moved to Canada, and I think that just lends me quickly to understand processes than if I'd come in from the outside.
Right. It is so big, though. It's like being you're like the mayor of a city or something. What is it? 20,000 plus employees, and that doesn't even include doctors.
Yeah, we've got 20,500 active employees right now, and yeah, we are spread over large geography. I think we're like the size of France, and
Wow.
we have 22 hospitals in 59 communities, and we also serve First Nations people on and off reserves. So yeah, it is big geography, but we have an amazing leadership team that's spread all over Interior Health. So
Yeah.
and technology really helps us connect quickly when we need to, and there's virtual care now in place for patients all over the place. So
Right.
the world has changed.
But when you talk about kind of the workplace climate, is that a challenge, not to just be kind of bureaucratic just because of the size of it?
I would say that there's small businesses out there that struggle with culture, and everybody's in the same building. Yeah. So, you could say, oh, it's because you're too big, but I don't really think that's the root cause of things. I think people feeling valued in their workplace is probably the #1 thing that makes people jump out of bed in the morning and go, yeah, I'm going to work.
Right. There's a sort of phrase to live by. I call it a motto, but that you have at Interior Health, and that is every person matters.
Yes, and that's a really good example of where we did do engagement, where the senior executive at the time, this was a few years ago, we were thinking something else, and we gave this over to our staff to take a look at, and it was them that came back with the Every Person Matters tag for us, and it really does sum up being patient and family-centered care. It's every person behind the scenes that helps get that touch on the patient right, whether it's payroll, our cleaning staff, food services, all the people behind the scenes that make it possible for the frontline professionals to do their job well.
Right.
So every person matters, and our workforce is key, but also for those we serve and their families.
Sometimes it's bad for one's mental health to look at the comments section underneath stories that go out, but every once in a while you have a look. And when you look at stories about Interior Health and say, what are people complaining about? I think a common theme is, it's just this huge bureaucracy with a bunch of people managing a bunch of other people, that it's top heavy. Is there any Is there room to cut? Are there too many managers?
We are probably the leanest health authority in British Columbia, and I would say that BC, from an administrator standpoint, is lean in comparison to the rest of Canada. So at times things may feel bureaucratic, but I don't think it's because we've got too many leaders in the process. We're very lean, and I think in areas across our geography, the local politicians, elected officials, our foundations, they all know who the leaders are. If you had millions of leaders, they wouldn't know who to go to. So,
right. So you don't start this job saying, "All right, here's how we're going to cut the fat."
There is no fat.
Wow.
No fat when it comes to leadership. We're very lean, and I think all our departments, not just our frontline management, all departments are, I would say, pretty lean in regards
Right.
to their staffing.
I was surprised to learn before this interview, I was just looking this up, that you've got more than 1,000 mental health beds already in Interior Health, but that never seems to be enough.
No, mental health and substance use is a service that we have together, and as you know, mental health as a society is on the rise, and we're looking at different ways to serve that population and making sure that when there is inpatient beds available for when people need that intensive inpatient service, but also getting people on to the next phase of their service where they can be managed in the community. So like just last week, we've got a news release that went out around intensive day service for people who want detox services. So
Right.
we're looking at creative ways of serving that population so that they don't have to stay in hospital
Yeah.
if they don't need to.
We talked to a woman just a few weeks ago who has been repeatedly reaching out to her sister, who is heavily, involved in all of these problems, street person, and their complaint is you get into detox, and it lasts X amount of time, and then you're out again, and then there just didn't seem to be a next step that would work for her.
Addiction is very challenging, as you know, for lots of people, and the evidence-based treatments, it's, as you say, people, they're in and out, and it can take a few times, and an addiction is not something that gets cured. So it's something where people become stable and they have great coping strategies, and that's what keeps them healthy, but it's not something that disappears.
No.
So some people do have to go through a few attempts of detox and addiction therapy to feel that they are in control of their
Right.
life.
And this is not an issue that the health authority can solve on its own. Are you encouraged by all of the efforts that are being made with this task force that's emerged and all of these efforts? Does it look like, from your perspective, that things are going in the right direction?
Well, when I think about the opioid crisis, for example, we know that there's been a high number of deaths across British Columbia because of that. But if we hadn't done all the harm reduction strategies that we had done, that death rate could have been as high as double what we've
Right.
seen. So sometimes I feel for the families and for people who have lost loved ones to that, but it could have been a lot more devastating if the health system hadn't rallied to do what they've done.
And yet BC seems to have suffered this opioid crisis on a scale that other parts of the country for some reason aren't. Do you have any understanding as to why it is? Is it just where the drugs went? Why was it such a...
I would assume so, and I think that's why British Columbia have, taken it upon themselves to look at the physician and college of, the College of Physicians and Surgeons have been looking at prescribing practices of physicians around opioids. So they're working with all the doctors out there to make sure that we're not starting people on that journey with pain control for completely legitimate reasons when they become addicted to opioids, and then the prescription disappears, and then they end up going to the illicit drug market. So
Right.
there's a lot of work happening at the front end to make sure that we're not giving people those types of drugs if it's not entirely necessary.
Our population is aging, isn't it? So I wonder if I would really want to have your job right now. Are you not sort of looking at a phase where there's just going to be more and more people demanding health services for the same amount of money? We're heading into a tough phase in terms of demographics, aren't we?
Yes, we are, but you know, I'll need it one day. So there's some vested interest in getting it right for sure.
Yes.
I think, you know, care of the elderly, seniors care, they have been very vocal with our seniors advocate in the province that they don't want institutionalized care. So right now we're really trying to make a shift to doing wraparound care in the community to keep seniors safe at home, and also take away, sometimes when you end up needing multiple specialists or multiple teams, it becomes very hard for them or their family to navigate that care. So we're trying to make sure that we're taking on the navigation responsibility to make it easier for them to access their health care.
So yeah, those sound like solutions that might actually be cost effective and best for the patient. So
yeah, and you've heard here in Kelowna, we're working with the divisions of family practice here, which are all the family doctors here, and they're really doing a fantastic job on trying to make better access for patients to the primary care when they need it. Because one of the things that we know that drives up our emergency numbers is when it becomes the default, if they can't get access to their family doctor.
right. Well, we like to keep these things to about 10 minutes. Is there something else, a message you wanted to get out before we wrap it up?
I guess just I'm extremely proud of our staff in Interior Health, and I hope in the years going forward we can continue to strive on and meet patients and families the way they want to be met with their care.
Terrific. Thanks so much for coming in.
You're very welcome.
Susan Brown, the new CEO of Interior Health, and thank you for watching Kelowna Now.